Did you know that just 1 cup of yogurt a day, a food that seems simple and familiar, can become a natural shield protecting your heart from unexpected heart attacks? At age 50, 60, or 70, most of us focus on blood pressure, cholesterol, or only see a doctor when fatigue lingers. But very few stop to ask, is what I eat each day quietly strengthening my heart, or is it slowly making it weaker? Every year, millions of people worldwide die from heart attacks, many of them passing within minutes without any clear warning signs. This forces us to look closely at what we can control, our diet. Among countless foods, yogurt is highly regarded by cardiologists and nutrition experts for its natural ability to support heart health, from lowering blood pressure and improving blood lipids to managing weight and reducing vascular inflammation, all of which are key drivers of heart attacks. But does this apply to everyone? Does eating yogurt daily truly lower the risk of myocardial infarction? Is more always better? And more importantly, which type of yogurt actually benefits the heart? Stay with us until the end of this video because you will not only get the answers, but also discover how to turn a simple daily habit into a shield for your heart rather than a hidden danger leading to disaster. So, what will happen to your heart if you start eating yogurt every day, beginning today? Before we continue, if you care about heart health, preventing heart attack and stroke, and learning about safe nutrition strategies for middle-aged and older adults, make sure to subscribe to the channel and click the notification bell. We share clear, reliable medical information to help you take charge of protecting your heart each day, starting with the smallest choices. There is an uncomfortable truth. Heart disease remains the leading cause of death worldwide. According to recent medical statistics, someone suffers a heart attack every 40 seconds. What is even more concerning is that most of these cases involve people over 50, and many die suddenly before they ever reach a hospital. This is not a condition limited to old age or those who are bedridden. A heart attack can strike at any moment, whether you are gardening, taking a morning walk, or simply sitting and having tea with your family. Many people believe that a heart attack always begins with crushing chest pain. In reality, it can start with something as mild as fatigue, shortness of breath, dizziness, or brief nausea. Countless patients ignored these early signals, assuming they were just signs of aging or irregular eating. That false sense of security has cost many their chance at survival because they arrived at the hospital too late. The heart cannot heal like skin or bone. Every minute without blood flow causes irreversible loss of heart muscle. The majority of older adults live with at least one risk factor such as high blood pressure, high cholesterol, diabetes, or obesity. When these factors combine, the risk of myocardial infarction multiplies. Add to this a sedentary lifestyle, diets heavy in refined carbohydrates, poor sleep, and neglect of health, and older adults are essentially walking on a fragile bridge without realizing how close they are to collapse. This raises a serious question. Are we focusing too much on treatment after the heart attack instead of preventing it in the first place? In reality, there are many factors we can control to reduce the risk of heart attack, and daily diet is one of the most powerful. This is where yogurt enters the picture. A food that seems so simple can play a surprising role in supporting cardiovascular health and significantly lowering the risk of sudden heart attacks. But why is yogurt considered so beneficial for the heart? Does it contain specific components that protect your heart every single day? Yogurt is made through the natural fermentation of milk, using beneficial bacteria such as Lactobacillus bulgaricus and Streptococcus thermophilus. It is not only an easy-to-digest snack, but also considered a superfood that nutrition experts recommend for daily use, especially for older adults. The first key benefit of yogurt is its high probiotic content, often referred to as good bacteria. These probiotics not only improve digestion, but also support the immune system, reduce inflammation, and regulate blood lipid metabolism, all of which are critical factors in preventing cardiovascular disease. A healthy gut microbiome improves the body's ability to manage cholesterol and blood pressure, thereby reducing strain on the heart and blood vessels.
Beyond probiotics, yogurt is also a natural source of calcium and vitamin D, two nutrients essential not only for strong bones, but also for maintaining stable heart rhythms and healthy cardiac muscle contractions. In particular, plain, low-fat or unsweetened yogurt is high in protein, which helps preserve muscle mass, stabilize blood sugar, and support healthy weight management in older adults, an important factor closely tied to heart health. Unlike other dairy products, fermented yogurt contains less lactose, making it easier to digest, even for older adults with weaker digestive systems or lactose intolerance. Its cool, mild taste also makes it easy to include in daily meals without causing discomfort or bloating. Inside just one small cup, yogurt delivers millions of beneficial bacteria, along with a wealth of micronutrients and high-quality protein, making it a simple yet powerful choice for anyone seeking long-term heart protection. But the question remains, how exactly does yogurt strengthen the heart? Does it truly influence the factors that lead to myocardial infarction, or is it simply a digestive-friendly food with indirect benefits? When people think about heart disease, they often focus on high cholesterol, elevated blood pressure, or blocked arteries caused by atherosclerosis. What is less recognized is that preventing these conditions largely depends on daily diet. Yogurt, when consumed correctly, can be a powerful ally for an aging heart.
First, yogurt helps regulate blood pressure, one of the leading causes of heart attack and stroke. Certain probiotic strains in yogurt have been shown to produce bioactive metabolites such as peptides that relax blood vessels and reduce vascular resistance. This helps stabilize blood pressure, especially in older adults whose arteries are already stiffened and less elastic. Second, yogurt can help improve blood lipid profiles by lowering LDL cholesterol, the bad cholesterol, and raising HDL cholesterol, the good cholesterol. When LDL builds up in the artery walls, it forms plaques that narrow or block blood flow, leading to myocardial infarction. Consuming low-sugar, probiotic-rich yogurt supports fat metabolism and assists the liver in clearing excess fat from the bloodstream. Another subtle but crucial benefit is reducing vascular inflammation. Chronic inflammation is a major risk factor for cardiovascular disease, and the probiotics in yogurt can regulate immune responses, helping to suppress low-grade inflammation in the arteries. With inflammation under control, blood vessels are less likely to sustain damage, and the risk of clot formation, a direct trigger of acute heart attack, is significantly reduced. In addition, eating yogurt regularly helps with effective weight management, which is especially important for older adults struggling with excess weight or abdominal obesity. The protein in yogurt promotes satiety, reduces food cravings, and supports lower calorie intake without strict dieting. Maintaining a stable weight also means reducing the strain placed on the heart. Another advantage is blood sugar control, particularly valuable for those at risk of type 2 diabetes or already living with the condition. Diabetes is a powerful risk factor that damages blood vessels and accelerates heart disease. Choosing plain or low-sugar yogurt helps regulate post-meal blood glucose, preventing sudden spikes and drops that can harm both vessels and the heart. All of these benefits are achieved when the right type of yogurt is chosen and consistently. Plain, unsweetened, low-fat yogurt rich in probiotics is the best option for cardiovascular health. Sugary yogurts, artificially sweetened products, or those with unnecessary additives should be avoided, as they may counteract the benefits. Though it may seem like a small food item, yogurt's impact on heart health is cumulative and long-lasting. The benefits do not appear in a single day or week, but rather build steadily over time, with each meal and each consistent habit. What matters most is persistence, regularity, and understanding how it works in the body to maximize results. But are these effects just theory, or have they been confirmed by scientific research? To answer that, we need to look at real-world studies from trusted medical organizations. So, what does science say about daily yogurt consumption and the risk of heart attack? The benefits of yogurt for heart health are not just speculation or word of mouth. They have been confirmed by major medical organizations and research groups through large-scale, long-term studies with clear conclusions. This has made yogurt one of the foods strongly recommended in heart disease prevention diets, particularly for middle-aged and older adults. One of the most notable studies, conducted by the Harvard School of Public Health, found that people who ate yogurt at least twice per week had a 20% lower risk of cardiovascular disease compared to those who consumed little or none. The effect was especially significant in individuals with a history of high blood pressure. The reason is that probiotics in yogurt help regulate blood pressure, reduce inflammation, and improve vascular flexibility. In addition, a meta-analysis of more than 10 studies published by European health organizations reported that regular yogurt consumption can moderately reduce LDL cholesterol and raise HDL cholesterol, both of which play a crucial role in preventing atherosclerosis and complications that lead to myocardial infarction. Another large study tracked 55,000 women ages 30 to 55 and over 18,000 men ages 40 to 75 in the United States for more than 20 years. It showed that those who consumed more yogurt, especially low-fat and unsweetened varieties, had significantly lower rates of cardiovascular disease. Importantly, this benefit remained even after controlling for weight, smoking, and physical activity. Experts from Mayo Clinic and the American Heart Association have also included yogurt on the list of beneficial foods for older adults at risk of heart attack. They emphasize that yogurt is accessible, affordable, and can be easily incorporated into daily meals without disrupting the established eating habits of older adults. On the other hand, several smaller clinical trials showed that people who consumed probiotics from yogurt for 8 consecutive weeks experienced significant improvements in systolic blood pressure and reductions in vascular inflammation compared to control groups who did not consume it. This suggests that probiotics benefit not only digestion but may also positively influence blood vessel health and heart rhythm. Although these studies differ in design and population, the common finding is a consistent positive trend linking yogurt to cardiovascular health. However, not everyone who eats yogurt will achieve the same results. The effectiveness depends on the type of yogurt, how it is consumed, individual physiology, and current health status. So the question becomes, how can you avoid common mistakes that turn yogurt from a heart-friendly food into a double-edged sword? Although yogurt is considered beneficial for heart health, using it the wrong way can eliminate its benefits and even cause harm. This explains why many older adults eat yogurt daily yet still struggle with high blood pressure, digestive problems, or even rising blood sugar and LDL cholesterol. The issue is not yogurt itself, but rather poor choices, improper timing, and a lack of awareness about individual health conditions.
The first common mistake is choosing sweetened or artificially flavored yogurt. Many products on the market contain 15 to 20 grams of sugar per small cup, equal to 3 to 4 teaspoons. Excess sugar promotes vascular inflammation, raises insulin, increases visceral fat, and accelerates atherosclerosis. For older adults or those with diabetes, this is especially dangerous, as it can silently raise the risk of heart attack. The second mistake is eating yogurt at the wrong time, such as immediately after a large meal or on an empty stomach. Eating it when full can overload digestion, preventing probiotics from working effectively. Eating it on an empty stomach can expose probiotics to high stomach acid, killing many before they reach the small intestine. The best time is mid-morning or mid-afternoon, about 1 to 2 hours after a main meal. Another mistake is combining yogurt with the wrong foods. Many people mix it with sugary fruits, jam, or pastries, causing sugar intake to spike. Others take yogurt together with supplements, calcium, or heart medications without medical advice. This can lead to negative interactions, reduced drug absorption, or interference with the body's natural digestive enzymes. In addition to mistakes in how it is consumed, there are also certain groups of people who should consult their doctor before eating yogurt daily. For example, individuals with lactose intolerance may experience bloating, diarrhea, or stomach pain after eating traditional yogurt. Although yogurt contains less lactose than milk, those who are sensitive should choose lactose-free options or plant-based yogurts made from soy or almonds. People taking medications for heart disease, lipid disorders, or high blood pressure also need to be cautious. Some commercial yogurts may contain added salt or preservatives that can affect blood pressure. In addition, consuming large amounts of probiotics may not be suitable for those with weakened immune systems or patients undergoing strong antibiotic treatment. For individuals who have had heart surgery or stent placement, dietary changes should be carefully managed and monitored. Finally, it is important to understand that yogurt is not a treatment for heart attack. It is a supportive part of a heart-healthy diet but cannot replace prescribed medication or medical guidance. The benefits of yogurt only come when it is used correctly. If consumed improperly, it can unintentionally place additional strain on the heart. So, how much yogurt is enough? Which type is best? And how can it be incorporated into daily routines safely to protect your heart?
Throughout your life, your heart has worked silently and tirelessly to keep you alive. Every beat is a sign of life, a reminder of hope. Yet the paradox is that most of us only start paying attention to our heart when it begins to hurt, when we feel short of breath, or when it suddenly stops. That is why, instead of waiting for disease to appear and then trying to fix it, the most important step is prevention, beginning with daily lifestyle choices. First, remember that energy does not come from caffeine or energy drinks, but from quality sleep and a stable biological rhythm. For older adults, getting 7 to 8 hours of sleep each night and keeping a consistent bedtime and wake-up time helps reduce stress, stabilize blood pressure, and regulate heart rhythm. Deep, restorative sleep not only gives you clarity the next morning, but also provides your heart with the chance to rest, recover, and repair. Next, a heart-healthy diet is the strongest foundation for long-term protection. Prioritize fresh, minimally processed foods, plenty of vegetables, fatty fish, whole grains, and natural probiotics such as plain yogurt. Avoid fried foods, fast food, sugary beverages, and foods that are excessively salty or sweet. No single food is a miracle cure, but consistency, balance, and discipline in eating habits are the real medicine for your heart. Another simple yet powerful habit is walking 20 to 30 minutes every day. Whether you are in your 60s, 70s, or beyond, light daily walking improves circulation, strengthens heart function, lowers cholesterol, and keeps blood pressure under control. Gentle activity also reduces stress, a silent factor that can trigger vessel constriction and raise the risk of heart attack. Equally important are mental and emotional well-being. The heart is not only affected by fat or blood sugar, but also by loneliness, anxiety, and accumulated anger. Spend time with family and friends and engage in activities that bring peace of mind. Keeping your heart joyful and free of heavy burdens is one of the most effective ways to live longer, healthier, and with greater purpose. Among all available options, yogurt stands out not only for its convenience, but also for its positive effects on digestion, immunity, and most importantly, cardiovascular health. But, as discussed earlier, not all types of yogurt are beneficial. Not everyone should eat it daily, and consuming it the wrong way can backfire. That is why yogurt should be seen as a small but meaningful piece of the larger picture of heart health. The truth is, your heart does not need anything complicated. It does not demand expensive medication or advanced technology. What it needs is for you to eat wisely, sleep well, stay active, maintain a positive outlook, and commit to small daily habits. Caring for your heart means listening to it before it cries out for help. In short, yogurt is a smart choice if you are looking for a dietary way to improve cardiovascular health. But even more important is the overall lifestyle and a proactive attitude toward health. If you have ever turned to energy drinks to stay awake or feel stronger, stop and ask yourself, is my heart strong enough to endure that kind of strain? Energy drinks are not for older adults with heart disease. But yogurt, when consumed correctly, can be a steady companion for your heart. And perhaps, instead of asking, how do I avoid heart disease, the better question is, what have I done today to make my heart beat stronger than it did yesterday?